Guys, this is Dr. Hub. In case you haven't subscribed, please do subscribe. This is a concise, well-crafted summary and it highlights only the important keywords. Sturge Weber syndrome. So the Sturge Weber syndrome, it is nothing but a white calcification. It is a white calcification is seen. This is following the gyri. So white calcification following that of the gyri. It has a presence of a tram track appearance. This is it's a hallmark feature, the tram track calcification. Then there's a history of the port wine stains. So they are present as well as with seizures. It is sporadic and it is not inherited. There is a cortical atrophy and this is of the affected side. To learn and grow daily like this, please do subscribe.